My name is Dr. Esma Akin, and I'm an Associate Professor of Radiology. I'm the Director of Nuclear Medicine at the Medical Faculty Associates in George Washington University Hospital. I'm the current President of the DC chapter of the American College of Radiology. The ACR website is the perfect place to start because it informs all of us about the local chapters and gives us direct links to the local chapters. I know our chapter is linked. And the second thing is to find where your local chapter meeting is and attend a meeting. Most of us are pleasantly surprised when we do attend a meeting. Some of these meetings are chapter meetings with CME conferences. Some of them do not involve CME conferences, but they really do involve networking. Ours involves 5 CME conferences a year where we bring speakers from across the nation, and we have many people attending for both the convenient CMEs that they can get and to talk to each other and to network with each other, to communicate with each other in the area. Our main goal as a chapter is really to educate our legislators and our regulators, and to communicate to them that radiologists are medical doctors, they're physicians that are trained specifically in image acquisition and image interpretation, and also to communicate to them that we work very closely with our clinical partners, our practicing physicians, and hopefully this partnership, this communication will encourage them to refer their patients to radiologists who are trained in the field and to discourage them in self-referral. Self-referral faces us today, and it's really fraudulent and erroneous use of healthcare dollars. It could harm the patient in both financial ways, and it can harm the patient in health ways. It could result in erroneous diagnoses by people who are not trained to recognize the nuances of image interpretation. In many ways, imaging should be left to imagers, and we're hoping as trained physicians to communicate this both to our clinical partners and to our regulators and legislators. What I would like to emphasize is that our chapter, the DC chapter, as I'm sure every other chapter, is a living, functioning organism. We have an executive committee made up of very valuable members of our local radiology community. These members are experts in their fields. They've been in practice many, many years. They bring experience. There are also members who have not been in practice for many years, but they bring innovation with their new ideas. So it is a very valuable executive committee. We have members from private practice models, we have members from managed care models, we have members of our executive committee from academic models, and I think the success of the chapter is really due to the variety of its members of the executive committee that diligently work and are as devoted to the chapter as I am today, and I'm very hopeful and very optimistic about the future of our chapter.